Well, good morning, everybody. I'm absolutely delighted that so many people have taken the time to join us today to hear more about the results of the Volunteering Innovators programme, and thrilled that at a time when there's so much pressure on the NHS at the moment, that so many of you have made a bit of time to hear about this, because we think it's potentially one area where we can support you with some of the challenges you're facing. I just wanted to start by saying a few massive thank yous. I want to thank all of the trusts who are involved in the programme. Clearly, without their support and the support of their wonderful volunteer service managers and volunteers, this would not have been possible. Thank the Helpforce regional leads, that's Roz, Desi and Ben, who spent the time during the programme supporting the trusts with capturing their data and designing the projects and implementing them. NHS England were our major funder, and obviously massive thanks to them, and in particular to Jane Fox, whose commitment to the programme was second to none. And also our other funder, Royal Voluntary Service, delighted to work with them, and particularly on the two projects that they specifically led on. And to our speakers today, and to the folk who have offered to represent the trusts on our Q&A panel. As far as the programme goes, the programme's been running for 2 years, and started back in July 2018. And at that point, I think we all knew that many people were aware of the value of volunteers, but we knew limited evidence of impact beyond the impact on volunteers themselves. And we felt that to get a broader view of impact of volunteering, it was important if we were going to develop an investment case to support the acceleration and growth and impact of volunteering. So our aims at the start of this programme was to improve the evidence base of the impact of volunteering, to develop and spread a wider range of high impact interventions, and to grow the Helpforce network, which provides peer-to-peer support amongst volunteer service managers. We had a massive response from trusts to the programme, which eventually we filtered down to 12 trusts across a range of roles, looking at anything from companionship, practical support, support with mobility, nutrition, hydration, a wide range of roles which we felt would give us a really broad evidence base going forward. And we worked with the trusts to help capture the data around a range of impacts, and specifically impacts around patient health outcomes, staff morale, health and well-being, systems, productivity and efficiency, and volunteers themselves. And perhaps most importantly, we learnt what worked and what didn't work in those programs. And the result of this now, which we're launching today, are three products essentially. There's a detailed evidence report, which you will be able to access using the link on that screen there. You can go through to the detailed evidence report. There's a summary report of the evidence, and there are 9 detailed scale and spread packages. So for 9 of the interventions, we've got some detailed packages which show how to scale and spread those interventions, and they're all at the link which is being shown on the screen at the moment. What the programme, I think, has demonstrated is that volunteer impact is not about numbers of volunteers. It's about the intelligent design of roles that are designed to deliver specific impacts. It's about designing roles which are designed for impact, and designing roles that are integrated within the clinical environment to make the greatest impact. We've also shown that you don't need a particularly large investment in management and infrastructure to actually enable these volunteer roles to take place. And whilst it's not a particularly significant amount of investment, we do need investment in volunteering management and infrastructure. And we hope that the evidence that we're presenting and the evidence contained within the reports will give... Hello?
Sorry, Mark. Sorry, keep going, yeah.
I'll carry on. The evidence contained within the report will hopefully give people the opportunity to develop their business case for further investment in volunteering in their own areas. Because traditionally volunteering is focused on, as I say, on the impact on volunteers themselves. But what we're now starting to present is emerging evidence around impact of volunteering on patient health outcomes, health and well-being of staff, productivity, and volunteers moving into employment. It's important also to remember that our aim at the start of this programme was not just to develop and work with 12 trusts, but actually to scale and spread these toolkits through a much wider range of trusts, and we're keen to work with those trusts. We're keen to provide you with the support to do that, particularly at a time when discharge and support for staff has never been more critical. And we're keen at Helpforce to support as many trusts as possible to take on these models and to expand them across their trusts and across the environments they're working in. That will also give us the opportunity to capture more data and build the data set as we go forward and increase the strength of the evidence for each of the interventions that we've got. Brief word on COVID. We think that for each intervention, we know that many of these roles have got the ability to relieve pressure in many of the areas of the hospital are currently under pressure. We've got a great number of examples of how volunteers are being supported safely in COVID wards and COVID hot and cold areas of the hospitals, particularly by adopting a more structured approach or stratified approach to risk assessment. And we're supporting a number of ESMs at the moment with the evidence of impact of some of these roles to help them make the case for volunteering at this time. We're always happy to talk to individual trusts who seek that support. So we are here to support you, and we're very excited about the evidence we're about to present to you. So without further ado, I'm now going to hand over to Julie Tran-Graham, who's our Head of Insight and Impact at Helpforce, who's going to share the findings that that have been delivered by this program. Julie, over to you.
Well, thank you very much, Mark. I'm absolutely delighted to present our headline evidence findings from the Volunteering Innovators program. My role as Head of Insight on the program was to work alongside Helpforce colleagues to help trusts to design their evidence plans, collect data, and then analyze that data, which was the backbone to this report that we're publishing today. One of our guiding principles for our evidence work has been measure the outcomes that matter. Having been involved in social action, innovation, and evaluations for the past few years, I know that volunteering services in hospitals are very good at measuring a few things. Things like number of volunteers, number of volunteering hours, number of patients supported, essentially inputs and outputs. These measures definitely have some value, and indeed, we've included inputs and outputs from the program in our new report. Next slide, please. However, as Helpforce and as a program, we believe that measuring inputs and outputs are only the start. We believe we should also be measuring the outcomes that matter most to our collective mission. Outcomes such as improvements in health outcomes, improvements in the experience of care, and improvements in the way we support staff to deliver care. This was a key ambition of the program, as Mark said, in terms of expanding the evidence base on health volunteering and showing the impact volunteering has on key NHS outcomes, ultimately highlighting how volunteering services can have measurable benefits for patients, staff, and services. And I certainly don't want to overlook the benefits for volunteers. Volunteers are important, and so are the benefits they receive from their volunteering. We did capture data from volunteers during the program and found positive links between volunteering and volunteer well-being, sense of purpose, and preference. However, we do want to change the conversation about volunteering services in hospitals. Yes, we want them to exist for the benefit of volunteers, but we especially want them to exist to help solve challenges that NHS organizations are now facing and will face in the future. So, what did we find when we looked at outcomes that mattered the most to organizations involved in the program? I'll spend the next few minutes giving you a brief overview of some of the findings that we found. From a patient's perspective, we found that volunteers improved patient experience and helped patients feel more supported at a difficult time. Survey responses for key measures of patient-centered care are consistently better for patients with volunteer support compared to patients without volunteer support. This is reflected in the graph in the presentation. So on measures such as being interested in you as a whole, really listening, and making you feel at ease, patients who are supported by a volunteer all score higher than those who are not supported by a volunteer. And that's a fantastic finding. We also see, based on our patient survey that we issued across the program, that patients with volunteer support are more likely to be extremely likely to recommend the hospital. And it does seem that the dose of volunteer interaction matters to patient experience. So that is, the more face time a patient has with a volunteer, the better their experience. As well, volunteers also play a very important role in helping patients to keep fit and well during their hospital stay and when they return home. For example, our evidence from Leeds and Morecambe Bay, the projects funded by the Royal Voluntary Service, suggests that volunteer support improves mood whilst in hospital and reduces loneliness in the community. The evidence from the community exercise sessions also demonstrates improvements in strength and endurance. Volunteers can also help to ensure that specialist care such as mental health and end-of-life care are more personalised. For example, with our colleagues at Camden and Islington, the data shows that more patients with volunteer support received a debrief following an incident compared to those in the control ward where there was no volunteer support. And the percentage is more than double, so that's quite a great finding. So it's clear that patients value the contributions of volunteers. Next slide, please. So we found that volunteers help the well-being of NHS staff and create more time for care. Here's some figures for you to consider. So 71% of nurses who were surveyed across the programme felt less stressed with volunteer support. And 73% of staff feel that volunteer support is helpful in allowing them more time to deliver good care to patients. From the perspective of freeing staff time to focus on the most productive tasks, on average, and based on the nurses who responded to our survey, we see that volunteers can save nurses approximately 26 minutes per day, and this is a average reported across all trusts. This did, however, vary across interventions, and we go into more of that detail in the report. When we asked what nurses did with that extra time, you can see their responses in the infographic here. So more than 50% said that they used that extra time to organize care plans and medicines. Nearly a quarter of the nurses who responded said that they used that time to support more patients. So the message is clear here. Staff and indirectly their patients are benefiting from volunteering services and their range of activities. Next slide, please. From a hospital service perspective, we found that volunteers contribute to the efficiency of a hospital. The first example I'd like to talk through is from Barts, which you can see here in the infographic. At Barts, staff perceive that because of the active response volunteer service, which supports the delivery of 2 take-away medicines. So those are medicines that are discharged with patients. Discharges can be sped up by 44 minutes per patient. The additional measurable benefit for staff with this particular role was saving staff time. So saving them time from actually leaving the ward and their patients to collect the medicines. And this savings was estimated to be around 29 minutes per TTO collection. In the graph in front of you on the right, you can also see that we had some really interesting findings from Sandwell and their activity and mobility volunteer evidence work. You can see on the blue line, the dark blue line, that as volunteer and patient interaction goes up, the number of re-referrals to therapy, which is the red line, goes down. And this is on a particular ward at City Hospital, where patients are medically fit for discharge and just waiting to get home. So we can clearly see from the graph that there may well be a correlation between the two because they mirror each other quite perfectly. We also have some very promising findings from Salford on length of stay improvements on wards where their dining companions are deployed. As well, we've gathered good anecdotal evidence from a number of the other trusts on improvements in patient flow as a result of volunteer support. These findings and the impacts on services are certainly worthy of further investigation. Next slide, please. Finally, in addition to the positive volunteer well-being results that we see in the data, the other main finding from a volunteer's perspective also shows that volunteers may pursue a career in the NHS as a result of their volunteering. In our volunteer survey, we asked volunteers to, on a scale of agree to strongly disagree, we asked them whether their volunteering at the hospital increased their interest in working for the NHS, and 58% of the respondents said that they agree or strongly agree with this statement. This percentage actually jumps up to 88% when we look at a subgroup of those responders, so looking at those specifically in between the ages of 16 and 40. We see similarly compelling results when we ask volunteers how their volunteering at hospital has influenced their interest in pursuing a health and care career more generally, and also how volunteering can support their ability to get paid work. You can see, therefore, that volunteering can potentially help volunteers with career opportunities. Last slide, please. So this has really been a taster of the findings from the program. You can dive into detail of these findings and our other findings in our latest evidence report, which is now available on our website. By downloading the report, you will also learn more about our approach, our methods, our limitations, and where we see the opportunities are in terms of growing the evidence base in the future. We believe these findings represent a key step for health volunteering and show that volunteers are more than a nice to have, that they can be as important to a speedy and healthy recovery as medicine and good nutrition. Our hope is that this report and the findings therein inspires leaders in NHS Trust to consider the opportunities that investing in volunteers presents. We also hope that more trusts will measure the outcomes that matter. It is challenging work, as the trust in the program will likely attest, but to measure is to know, and we're developing more tools and more guidance that will hopefully support you on your journey to impact measurement. Thank you very much for listening, and on behalf of my co-author, Mark Booker, and our data analyst, Rachel Spath, we hope you find the report useful, and we're very much looking forward to hearing your feedback. Back to you, Mark.
Julie, thank you so much, and thank you for all of the hard work that you and the team have put into producing that report. We're now going to go on to Neil Churchill, good friend of Helpforce and key leader within NHS England, to share his perspective on the work that we've done, particularly in the context of COVID. So hopefully Neil is there, and over to you, Neil.
Good morning, Mark. Good morning, everyone. Can you hear me okay?
Yes, we can. Thanks, Neil.
Good. I always have to check that with my teams. So good morning, and thank you very much for a fantastic presentation. Some really interesting findings, really stimulating work. I just wanted to say, I think, three things, particularly about what COVID-19 has meant for the volunteering agenda. I think, and I'm going to echo some of the things that we just heard in that presentation. I think, first of all, that very clearly volunteers are not seen as an add-on, but a core part of the way that the NHS now functions. And I think we see that reflected very clearly in volunteer status as key workers. So this isn't, volunteering programs aren't something that we want to see suspended or downsized during COVID. We think they're really needed, and they're having a significant impact. And we're very pleased. I think key learning from the first wave from NHS organisations was that volunteering can continue within the infection control guidelines. So we're very confident in the importance of volunteering during COVID, and that's one of the reasons that we're continuing with the winter volunteering programme to look at how we strengthen volunteering through COVID, flu, and other winter pressures. So I think that case clearly made in the findings that you've just seen. Equally, as we've heard, we need volunteering to be safe, and we need volunteering to be safe on an individual basis. So we do need to think about whether the right people are doing the right roles in the right ways. And clearly, we know a lot of thought is going into that. Now, the role profiles, Mark, that you alluded to, and that NHS organisations have been sharing on NHS Futures too, I think are really important in how we adapt volunteering for an environment where COVID is endemic, and some tips about how to shift and adapt previous approaches into a COVID world. I think a couple of things I'd say to that. I think we do need to be open to new volunteers coming forward. There are many instances of volunteers at lower risk to COVID coming forward to support the NHS and its work, which is very welcome. It also helps us with the diversity of the volunteer base. But we also need to think about what happens to those for whom it's not safe to continue in the ways that they have been volunteering. Can they volunteer on the phone? Can they volunteer through their laptop, etc.? And I think some great examples where services have been adapted to allow that. Do want to say that if you do have volunteers for whom it is not safe for them to continue in what they've been doing, and you don't have other roles for them, that you can signpost them towards NHS volunteer responders, because some of the roles that we've designed there have been designed for people who are shielding and people who do need to stay away from any COVID risk. Some of those check-in and chat support roles, for example, will be open. So it's trying to, I think, that there is work for everybody to do. We just need to coordinate and make sure that we're signposting people in the right direction. But thirdly, I think just to reflect, it's a question, I guess, about whether COVID has taken a volunteering agenda forward or whether it's held us back. And my sense is that COVID has actually strengthened the position of volunteering strategically within the NHS. I think we've seen unprecedented levels of interest in volunteering, both from people who are interested in volunteering and the number coming in to volunteer for the first time, but also unprecedented levels in terms of number 10, the Cabinet Office, the Secretary of State, Simon Stevens, others taking an interest in what volunteers are doing, and in additional things that volunteers might do. And I think the continuing innovation that we're seeing around the NHS and in colleagues in the voluntary sector has been really important in supporting that unprecedented levels of interest. So we are seeing progress, I think, against our long-term plan ambitions in terms of more people being involved in the NHS in volunteering, greater diversity of people being involved in the NHS, which helps us in other ways, and higher impact. But not everywhere have we sealed the deal in terms of seeing sustainable resources going into volunteer management and volunteer deployment across each NHS organisations. And I think that the point you've alluded to in terms of measuring impact is vital to that. So we know that volunteering improves quality, we know it improves the staff experience, we know it improves productivity, and we know it is an important channel for the future workforce. I think we need to continue to build on the work that you shared in order to really demonstrate the impact that is being achieved against each of those measures. And then we will see, I think, the ambition that we all had of volunteering being much more securely firmly located in each NHS organisation will be realised. But I do think we are moving forward faster than we expected as a result of the unprecedented levels of interest in volunteering that have been seen through the COVID response. Thanks, Mark.
Thank you very much, Neil, and it's great to have your support on this. And I think we would all agree, and I know, I guess the majority of people on this call would agree, that making that leadership case for investment is critical, and hopefully that the evidence that we've assembled here will help with that. Moving on now to some of the projects. I'm delighted that Ruth from Sandwell in West Birmingham is with us, and she's going to talk to us briefly about how they went about embedding the mobility volunteers within her trust. So Ruth, over to you.
Thanks very much, Mark, and good morning to everyone today. It's really exciting to be here. So at Sandwell in West Birmingham, we had mobility volunteers on our acute medical assessment units and our medically fit wards to encourage patients to retain their mobility. The volunteers also encourage patients to get dressed into their day and get moving by our therapy teams. We found out a lot from this intervention, and as Julie's explained some of the key findings from all of the programmes that were involved, we found that the more interaction, perhaps unsurprisingly, that volunteers had with patients, the more of them were in their day clothes and being a bit more mobile than they would otherwise have been. We also found that patients had less need for additional therapy input. Staff felt supported, some of their time was saved, and volunteers really enjoyed the experience, and some of those were gaining really valuable insight to support them with future careers. Throughout the programme, we flexed our approach on a fairly regular basis, and that was really important so that we could see what worked best and what we needed to change to have the most impact. So, for instance, we noticed that it was tough for volunteers on our medical assessment units, whereas there was a more impact in terms of the mobility role on the medically fit wards, and engagement and ownership from the therapy teams really helped the volunteer intervention progress. Clearly, we were motoring along very nicely, and then COVID hit, and like every trust right across the country, we had a huge impact to deal with. So the wards where we had our mobility volunteers very quickly changed. One of them became the ITU expansion, and we largely removed our ward-based volunteering roles, turning them to a response role. We are hoping to return our mobility role shortly in a safe way, as Neil's alluded to, following volunteer risk assessments, with additional infection prevention control training for our volunteers, and selecting certain wards where COVID transmission risk is lowest. Of course, the situation is ever changing, and we need to continue to be agile in how we flex our volunteer service and the roles that we have available to keep our staff, patients and volunteers safe. So our trust response to this intervention has been fantastic. The board gave the project senior leadership support right from the outset. And I would say it wasn't and isn't the hard evidence that convinces our trust of the values of volunteering. Through the volunteer service, we've really been able to demonstrate the benefits of how we can bridge the community and the trust, and bring benefits to our inpatients, of course, but also to people in the community, providing them with help in terms of confidence, a sense of purpose, and really valuable experience, which in the current climate is absolutely essential. And this is ever more important to us as we work to more of a place-based approach, and through the volunteering opportunities that we think we can provide for people in the local area, as well as partnerships with voluntary organisations, local and national charities. We think we can further support people's health and well-being, not just our inpatients and not just the benefit of our paid employees. We really benefited from the Helpforce programme. We had significant support in project planning, how we developed the programme, and of course how we evaluated the impact that the volunteer intervention was having. We had dedicated support with a project manager, and absolutely essential with the opportunities to learn and share our learning with others. And of course that learning will continue, and we're really grateful for the opportunities that Helpforce has provided to allow us to do that. So I just wanted to end by a thank you. So thank you to everyone involved with the project that we had here at Sandwell and West Birmingham, to Jonathan and our volunteer service team, and of course the Helpforce team, who without their support our project wouldn't have been able to progress to the way that it has and delivered the outcomes and impact that it has. It's been a pleasure and a real privilege to be part of this valuable programme. So thank you very much.
Thank you so much for that, and I'm glad it was a success. Apologies for that. Hope that's a bit better. hope that sounds a bit better, does it, Bea?
It's not really the best, but keep going.
Okay. I'm going to hand over now to Nancy, who's going to talk about how they've adapted their response volunteers model to be effective during COVID-19. So, Nancy, over to you.
Nancy, are you there? Just have to unmute yourself. Just give me a second. I have a feeling that Nancy is not here with us. I will give her a call, but if in the meantime, then
hello, I'm very sorry, everybody. I'm back.
Perfect. Thank you so much. Yes.
I'm very sorry. For some reason, it just totally disconnected after being announced so nicely. Can you all hear me, firstly?
Yes. Yeah.
Brilliant. Okay, so I'm Nancy Wiskin. I'm the head of volunteering for Barts Health Trust. I'm very thankful to be here today to feed back to everybody about the wonderful success we've had through our project. Just to talk a little bit about our previous model, which was to place volunteers onto wards in such roles as befrienders, mealtime champions. But it became increasingly clear that that model was not working for us. Volunteers would come back to us saying that they hadn't felt utilised enough, that we weren't getting the volunteers to the patients that really needed them or to the wards that really needed their support. So we decided to completely change our whole model and to go for a response model. And that's really helped us to make sure that the right volunteers are getting in the right place at the right time. We also think it's really important, how do we get people to tell us where they think volunteers can help them the most, rather than us dictating where volunteers should go. And I think the beauty of the active response programme is people are actually telling us, staff are telling us, this is where we really need your help. And we were able to create this really multifaceted, multi-purpose role aligned to a really good, strong package of training, which meant that we were really getting volunteers to places where staff needed them and needed their support. And then COVID hit us. Initially we stood volunteers down, but within 2 weeks we were able to adapt our current active response model to the pandemic COVID-19 response model. And that was because primarily we had great visibility. So we'd set up our volunteer hubs. Everybody knew they were there. Everybody knew they could come to us, to the desk, and ask for our help. We had the right policies in place, the right governance in place to be able to do the work. I'd say small things like having a fact sheet with all the information about the type of things that volunteers could help with was also very helpful in volunteers understanding exactly how volunteers can help, because I feel there's always a little bit of a problem with that. How can the volunteers actually help if they're not able to support us clinically? We also made sure that we attended key meetings, things like huddles, to really listen to how could volunteers support. And to be honest, it's been tremendous. We've had such visibility, such success. As Neil mentioned, a lot of our existing volunteers did stand down, but we had a response forward wanting to help. It was terrific, and we were really able to help. We helped with staff wellbeing, we helped visitors, we helped people who were distressed at the front entrance, who needed to find out information. We helped visitors to get their meals or whatever to the loved ones. It's been absolutely phenomenal, and we couldn't have done it without having that wonderful response model in place that we've managed to achieve through the Helpforce funding. I think I don't really have very much to say beyond that. All I can say is that, we're continuing and the requests continue to come in and we continue to adapt. We're very clear about the risk assessments. We're very clear about what volunteers can and cannot do, and we're working very well with departments because their volunteers are so valued now by the Trust that places, estates and facilities, for example, are very keen to support us with whatever we need to do to ensure that volunteers are volunteering risk-free. And so I think, to take home from this, get a hub if you can, be really visible, be right at the front of the hospital, wherever you can. Create a very simple fact sheet and information sheet which you can hand out so people are very clear about what they can ask for within the parameters of the volunteer role, and set up a really strong training package. One thing to add, that we have had lots of people go into work as a result who actually now work for the Trust, and it's an incredible success. And all I can say is thank you very much to Helpforce, and I hope that people have been able to hear this. Thank you.
Thank you, Nancy. We've heard that loud and clear, and it's great to hear how the relevance of this programme is being applied to COVID-19 situation and the application of those new roles. So thank you for that, and thank you to Neil and Ruth for bringing that NHS perspective, which is so important to us. I think for us, we don't see the launch of this report as the end of the programme. We see it as the start of the journey to really try and accelerate and grow the impact of these roles across a much broader range of trusts. And we've put some suggestions on there as to how we can help you. There's an example there of an extract from one of the scale and spread packages on the screen. But I think there are ways in which we can work with you to help you. We've spoken about the importance of developing a leadership case to unlock that funding and resource to invest in volunteering. We can do that. We've got some templates for leadership cases we can support with. I think Helpforce Connect, which is our peer-to-peer support platform, is so important. The way that we've seen trusts supporting each other and sharing ideas with each other has been really fantastic. The packages themselves are now on the website, and there are 9 detailed packages which set out the roles, but also how you go about introducing those roles, the work streams, how you go about measuring impact. All that content is there, and I think we've obviously got we've got the support of the team who are there to work with you to answer any questions you may have around this. So please do contact us if you're keen to explore how any of this work can support you. We are here to help. We've had some questions, and Paddy's been working away in the background, sort of going through the questions which have come through. We've got an esteemed Q&A panel there. I'm not sure if everyone will get a question, but I do appreciate everyone making themselves available to answer questions. I'm going to hand over to Paddy now, who's picked out the most common themes coming through from the questions, and we'll place those with members of the panel. And then once we've done that, we'll sum up, and then everyone will be free to go. So Paddy, over to you.
Thanks, Mark. Can you hear me okay?
Yeah, can hear you loud and clear, Paddy.
Well, firstly, just a bit of an administrative question. A few people have asked, will we be sending out these slides? So yes, we can package up the slides and send the various links to the different documents to the attendees after this call. And the first question we had was, how could the evidence from the VIP programme make a difference to staff and patients? I'm sure there's quite a few people on this list who could stick their hand up and answer this one. If I could maybe start with Pat at Samwell. If you could just unmute yourself, Pat.
I am. I'm muted. Hello there. Hi, everybody. It's been absolutely brilliant. I've really enjoyed the presentation this morning. From our perspective, I would say how it would benefit our trust is the fact that we could probably then roll some of this out in other areas. It doesn't have to just stay with mobility. We've got other areas. We've got a bereavement team. We've got, we want to do some new roles, introduce some new roles. So I believe that the model that we have, we can use, because we're working with the clinical staff, we're working with patients and some of their families. So we've got lots of areas actually that we could put this into practice with.
Thank you, Pat. And does anyone else from our panel wish to answer that question? The question again was, how could the outputs from this VIP programme make a difference to staff and patients?
Paddy, it's Neil here. Could I come in briefly
Please
on that?
do.
I would just say that, so whenever I visit a trust, I always try and talk to the chief executive and to see to what extent volunteering is on their agenda. And my experience of talking to chief execs is that different reasons put volunteering on their agenda. So for some, quality is strongly there. For some, it's staff experience. For some, it's productivity. So I think being able to cite in the way that you have examples from all of those and showing how volunteering makes a difference to all of the things that matter to chief execs will make it easier for us to engage what it is that's on the chief exec's agenda and demonstrate what the contribution is that volunteering makes to that. And I think that is important in terms of the sustainability of the investment that we'd like to see.
Fantastic. Thank you, Neil. I can also see, Joe, you've got your hand up. Joe Scott.
Yeah. Hi, Paddy.
Hi, Joe.
Yeah, I just wanted to add in that I think it's really useful for showing to patients the differences that the interventions can make, particularly to ours. We're telling them that their voice is used in a positive way to create change, but this will really demonstrate to them how that's being done, so they can have a look at it as well. So I think it's really useful for that point of view.
Fantastic. So next question, do you see senior NHS trust leaders taking volunteering more seriously with these findings? I might point this one back at Ruth, given that we've got a direct level person from a trust on our panel. Ruth, would you be happy to answer that one?
Yeah, of course, no problem. I mean, I think the evidence that's been provided and shown through these programmes is absolutely fantastic. I think we haven't, in volunteering, seen that real hard outcomes, and clearly you've outlined that there's some areas that have got really concrete evidence and some where there's more to look at and do a bit more in-depth research into. However, I think many boards, like Neil has said, really want to see what impact volunteering has on patient experience, staff morale, efficiency as well. So the hard evidence is really valuable and important, but also the impact on experience. And like I was mentioning earlier, from our point of view, as we move towards a place-based model, we want to do much more to bring communities and the trust together, and volunteering has an absolutely vital role to play in that.
Fantastic. Thank you, Ruth. Another question we got here is, what do you think is the key bit of data or evidence that will create the clinical pull for volunteering? So I think that means, how do we get clinical staff more on board? And I was going to invite Natalia from Moorfields, whether you had a view on this one, given the close relationship you have with clinical staff with your project. Are you there, Natalia?
Hi, it's Angela here from Moorfields. Natalia's having problems logging on.
No worries. You have that question, Angela?
I can try. Yeah. So sorry, could you repeat it again? Sorry, it's the clinical.
Yeah. What do you think, kind of from a lot of the evidence we collected, even your trust as part of the programme, can create a clinical pool for volunteering? That was the question, which I think means, how do we get clinical staff more engaged with volunteering?
Yeah, I think from our point of view, because we were actually, our whole project was linked very, very closely with the clinical staff, because obviously we were having volunteers actually in the theatres holding hands with patients. So it was absolutely essential right from the start that we were able to demonstrate the need for volunteers to actually support the clinical teams. We demonstrated this really by the reality was that the word of mouth, really. The fact is that the clinicians themselves soon began to realise that the patients were a lot more calm, that there was a lot more, it was just easier for them having a volunteer involved. We found there was initial resistance, particularly among some of the nursing staff. I think they found it potentially, they were concerned that the volunteers might be taking on roles that they themselves should be doing. But over time, as the project embedded itself, we found that it was much more accepted and acknowledged, and it came to the point where the consultants were asking us for volunteers. So it was over time and just demonstrating the success of the project showed the clinical need.
Brilliant. Thank you, Angela. Yeah, no,
Really,
thank you.
probably Natalia would have given a better answer, but she's been unable to log on because of internet problems.
Thank you very much. And Pat, you've something to add on this one as well?
Yeah, I was just going to say it is about sharing the success stories.
Yeah.
I mean, we are fortunate. I mean, you've heard Ruth today. We are fortunate to have a director of comms looking over our volunteers. So therefore, we have a nice direct way into the comms, and they highlight and they promote, you know, some of the things that the volunteers are doing. And I think that makes a big difference, because there's nothing better than when somebody's experienced something and they share it, that lights a fire in other areas of our trust. And I believe that's what's happened with us. We don't struggle too much to get volunteers in different areas, and I think that's because we do share our success stories.
Great, thank you, Pat. We've got a non-panel member with a hand up. Mandy, have you got a quick point to add to that?
Mandy, you need to unmute yourself.
Don't worry, Paddy, it's okay, because I think Angela's sort of said what I was going to say. So that's fine.
Thank you, no worries. The next question, how can trusts adopt the volunteer innovations you've packaged up, given constrained resources and some of the COVID restrictions? I might put this one to Mark, because I think, Mark, you've chaired a few calls with a number of trusts on this topic recently. Would you be happy to take that one? And if anyone's got anything to add, they can stick their hand up.
Yeah, sure. I mean, I think there've probably been three things which have come up when we've spoken to trusts. I think the one thing is about getting that leadership support, and that seems to be the golden thread that runs through this, and has come up on this case. And I think that the evidence that we've got here can now be tabled to align the evidence with the priorities that each individual trust has at that particular time to try and get that support for volunteering. I don't underestimate the power of the case studies. I really think that when senior leaders see the case studies, and I know when we've spoken to some across a number of trusts, and they actually see the case studies and see what other trusts are doing, they start to take a far greater interest than when we talk about it as a random concept. And I think the third thing is the how-to guides are so important, because often the question is, how do we do this? And I think with the scale and spread packages that have been developed, they're so detailed that people have got that information at their fingertips. So I think it's about using the evidence to develop the leadership case. I think it's about using the case studies to show what other trusts are doing, because that provides a heck of an incentive to a trust when they see other trusts are actually doing this and making an impact. And I think having the detailed guides to show that it can be lifted off the shelf and implemented is a really big positive part of it. And I think it's that content and it's that support that's available that will reassure leaders. So you take it beyond, you know, wishing or hoping to actually very practical evidence of implementation. And to Neil's point, at the particular time, I think it's very much about concerns around health and safety. But where volunteering is thriving in trust, they're applying the same procedures and same processes to health and safety with volunteers as they are to staff. And I think that makes a big difference as well.
Thanks, Mark. I can see no other hands up for that one, so I'll move on to the next question. What is the trusts that were involved in the programme's view of data collection? So what are the challenges and the benefits of data collection? I'm sure we've got a few people with something to say. I'm going to pick on you first, Nancy, only because I know I've had lots of conversations with you recently about data collection, how you've carried it on going, but it would be interesting to view of some of the other people on the panel too.
Yeah.
What's your view, Nancy?
My view, it is a challenge to collect data, particularly from staff and from patients, because what you need to do is you need to collect data that's really clean. So then you're relying on other people, such as staff, to collect patient data. And there is also the fact that a lot of patients are pretty fed up with having lots of questions to keep answering. So things like the FFT or the different questionnaires they get. So it's difficult to get people to complete their evaluations for you, and the same with staff. So that's a challenge. I think that's the biggest challenge. And making sure that the questions are asking things that are really meaningful, impactful. and trying to align it to being able to really demonstrate that because of the volunteer, this is the outcome. And I think one of the best ways for me always is just anecdotal, just case studies. Anecdotal is word of mouth. You know, all of those things are great assets in trying to get people to feedback about their experience of working with and being a beneficiary of a volunteer. Is that helpful?
Yeah, of course, it's really helpful. Thank you, Nancy. We've also got Ruth and Samuel, your hand up.
Yeah, thanks. I mean, I'd totally echo what Nancy said. We found it a real struggle to get staff to complete surveys. We sent volunteers around to encourage patients to share their experience. So it wasn't easy. I think one of the things in our project was how we used our volunteer management system and encouraged our volunteers to answer questions about the shift that they'd been supporting. So it wasn't perfect and not all of our volunteers did it all the time, but having an electronic way where they could easily do that on their own phones was helpful and enabled us to get some pretty reasonable data.
I agree with that. Yeah.
Thank you both. I mean, just to also add that, you know, with a lot of the kind of knowledge and experience and processes that Helpforce has collected over the last few years with the Insight and Impact program, whether that be, you know, the standardized surveys, a lot of the knowledge of how we've collected data from systems, from, you know, IT systems and admin systems, things like that. All of that is going to be shared, you know, so that knowledge will be available to all trusts, so we can try and build on what we've learned over time, because completely agree, you know, data collection is very hard, and hopefully everyone will see that from the evidence findings it's worth doing, but it is, you know, I think we recognise that for the trust it was the biggest and toughest barrier throughout the programme. Thank you both.
If I can jump in, Paddy, sorry, just to echo that. I mean, we did ask everyone who was involved in the program about project implementation enablers and barriers, and I think data collection did come up as one of kind of a key challenge, but I think it was also recognized as an enabler in terms of gaining support from senior staff, from clinical staff. So it can be both things at once. But I think you know, some of the projects that were most successful in terms of collecting data were the ones who engaged quite closely with quality improvement teams, information support teams, and things like that. So I think it's don't fear the data there, because it's if there's a will, there's a way, and I think there are people at the trust who can support the process, and of course we're here to support that process as well.
So could I just add something there as well? I would say that, sorry, I really need to make this point, because I feel strongly that as volunteer managers, there's an expectation, you know, it's a very broad job, isn't it? And then when you've got to think about collecting data as well, and none of us are probably expert in data collection, and I think we need to always consider that, as well as managing volunteers, as well as setting up roles, as well as all the communications, all the things that we do. So I think it would be a really good investment to have someone who can support trust to collect this data.
That's a very good point, and it's one that we will take on board in Helpforce, Nancy. Thank you. So we've come to the end of our time slot for the questions. We've got a couple of outstanding questions I didn't get a chance to ask. One was around a link to NHS responders, and one was about the involvement of unions that I was probably going to ask Neil for, but we've timed out. What I will do is we will get hold of Neil after this webinar and get his view on those questions. And when we share out the slides and all the other materials off the back of this call, we can put all the questions out and some of the answers as part of that info we send out. So back to you, Mark. Thank you, everyone.
Thank you, Paddy, and thanks everyone for that. I think the questions and the responses and the presentations have really added a great deal of richness to this event today, and I really appreciate that. Just want to thank everybody for taking the time out. I realise people are incredibly busy, so to give up an hour of your time to listen to this is really important to us. So thank you so much. We've mentioned the resources that have been produced. The links there on the screen. Please go in and look at the report. There's a summary report, there's a detailed evidence report, and there are all the individual packages there. Yeah. We're keen to scale and spread volunteering as much as we possibly can, and We can only do that in partnership with you. And this has only been possible because of a brilliant partnership with NHS England and Royal Voluntary Service and the trusts who've been involved in this programme. And by all of us working together, we've managed to produce evidence that hasn't been available before. We've assessed the quality of the evidence, and we know that by rolling this out further and capturing more data, we can only enhance and strengthen the picture of volunteering and the impact it can make for patients, for staff, for the volunteers themselves, and for the systems. So we really look forward to working with you going forward. And before I sign off, I just want to make a plug for the Wall of Fame. You will know that during the course of November, we are highlighting volunteers who've gone above and beyond over the last year. Many of your trusts will have nominated people. And on our Wall of Fame, we're showing case studies every day and using those all on our social media channels. So please have a look and celebrate volunteering. That's what this is all about, the difference that volunteers can make. Thank you all so much for taking part, and the very best of luck and best wishes from all of us at Helpforce. Thank you.
I should have said about some of our output, shouldn't I?
Hi, Nancy, we can hear you.
Sorry, I keep thinking about all the things I needed to say, because thank you very much.